In today's Health Beat, an irregular heartbeat can affect anyone at any age, and sometimes the signs that it's happening aren't clear. Now, that was the case for one Acadiana swimmer who says a simple procedure may have just saved his life. For 9 years, Richard LaFleur has been training, swimming every day in the hopes of one day taking home the gold.
My main goal in swimming is to make Olympic trials by the next, not by 2020, by 2024. That is my one main goal in swimming.
But that dream was almost shattered after a routine physical.
And that day they were checking me up, everything was fine. And then whenever the doctors checked my heart, he noticed that something was a little off. So then they called in more doctors to see if it was actually something wrong. And they were like, yeah, it's there, your heartbeat's a little irregular.
Richard says he and his mom were shocked. In all of his years that he'd been swimming, he'd never felt it. Surgery was the only option. So Richard and his mom headed to Ochsner in New Orleans. But that surgery never happened. Richard said his heart started beating normal and he was told there was nothing doctors could do. Richard kept swimming, but his endurance was down and his hope for Olympic gold was slowly slipping.
It's affecting the way that I was swimming. It just seemed a lot harder than it normally would be.
So he decided to take another shot at surgery, this time with Dr. Patrick Welch, a cardiologist with Our Lady of Lourdes.
And so what we talked about was what's called a cryoablation procedure, where the catheter that we use to actually perform the tissue destruction freezes the tissue as opposed to cauterizing it. Tends to be less traumatic, better tolerated by the patient, and in the long run, I've found it to be more effective with a lower chance of the rhythm recurring.
And that's exactly what they did.
So we put it in the body deflated and then inflate it when it's in the atrium. And then it literally wedges into the opening of the vein like this. And then we run a refrigerant through to cool the balloon -80 centigrade for a 3-minute freeze. And that's it. There's 4 veins. We freeze all 4 of them and the procedure's finished.
Hours after the surgery, Richard was back home, and a few weeks after that, he was back in the pool, swimming laps and competing in relays.
Ever since then, I've been fine. I've been swimming perfectly, and I'm just thankful.
Richard says while the road to get to this point was a long one, it was worth it, making him realize to never take anything for granted.